at the time. Okay, so sleep. All of us do it. We do it to different levels and at different times, but generally we sleep about 1/3 of the day, so 1/3 of our lives. And many folks think sleep is a passive thing. You're unconscious, so everything is working less. Not the case. Sleep is quite an active process. Our glands work according to the circadian rhythm, the 24-hour circadian rhythm, in producing hormones. For example, I'd say growth hormone. That's produced at night. That's how I entice my children to sleep better and longer so they can get taller and bigger. Many of you may have noticed, if you had somebody with diabetes, that they wake up in the morning and the sugars are high, they haven't had a meal yet, because the cortisone is produced closer to the morning time. So it's an active process. The brain is not off. It can slow down certain stages of sleep, especially the delta sleep, the deep sleep. But then it becomes very active in the REM sleep, rapid eye movement, or the dreaming sleep. It's a very active process, and we know that from multiple different testings that are done on patients during sleep. Okay, so how many hours of sleep do we get? Unfortunately, I do see pediatric sleep medicine patients too. So unfortunately, the recommendations for sleep in kids, and let me start with kids, is as you see out there. And I'm sure the majority would say, oh, my kids, my grandkids never get this many hours of sleep. Unfortunately, that's a function of the things that we do in the society and not really what the brain needs. Toddlers, almost 12, half of the day, 14 hours. Teenagers, 9.5 hours to 10. How many of our teens sleeping even 6, 7 hours? I tell you, I see lots of patients, different ages. And unfortunately, the majority of the pediatric patients I see don't even come close. And that affects their function during the day. It can affect their education. Some of them end up being diagnosed with attention deficit disorder because sleepy kids are hyper, are inattentive, unlike sleepy adults. Going to the adult part of it, the 7.5 to 8, that is by consensus agreement between the leaders in the field of sleep medicine. I'm sure you know folks that sleep less than that, but they are fine. They function fine. They're not struggling through the day. And that is, I always leave Dr. DeBakey's name as late Dr. DeBakey, the doctor that really invigorated this medical center in Houston and world famous cardiac surgeon. He used to sleep 4 hours and he would operate all day. He was fine with it. On the other hand, you have people that would need 9, 10, 11 hours to feel refreshed. So it's a range, but these are the numbers overall to refer to. A pregnant woman needing more sleep, obviously, because of the fatigue is increased, their heart rate is faster, especially coming towards the later part of the pregnancy. So that's the explanation of their need of more sleep. So what causes us not to sleep enough? As I mentioned last slide, many of us don't. Genetics, there are some genetic disorders that can cause insomnia, meaning their parents didn't sleep well through the night, they just couldn't sleep even if they tried. The offspring, the child couldn't as well. And usually that starts early in age, even preteen years, and persist maybe even worsen. In aging, we develop more medical problems, which can cause sleep disruptions. Common one, going to the bathroom often through the night, diabetes with sugar changes, pain in the joints, all that can interfere with sleep. in menopause, the hot flashes and the hormonal changes can disrupt sleep and cause brief and sometimes not so brief awakenings through the night. So it's not a straight sleep. Sleep apnea, which we'll come to talk about here in a little bit, is a major sleep disorder that we see in the sleep clinics, and it does disrupt sleep. Patient may not be aware that they're waking up many times through the night for a few seconds at a time, but usually the bed partner may be. Diabetes, we mentioned the need to get up and go to the bathroom, or if sugar's too low, too high, would disrupt the sleep. And pain and of any type. Dementia, the sleep-wake cycle get disrupted, and that can develop problems of sleeping through the night. People with COPD, asthma, developing wheezing or shortness of breath, and then wake up, diarrhea in the digestive system. So there are many conditions that can reduce the amount of sleep. Medications, folks are on lots of medications that we all know. Lots of them have side effects. Some can cause sleepiness, similar to the anti-anxiety medication that people take, the Valium, the clonazepam, the Xanax, and many of the medications for depression. While others may disrupt sleep and give nightmares, like metoprolol. There are medications that increase stimulation, like stimulants we use in attention deficit disorders or in narcolepsy. So all that can affect it. And the doctor, your sleep doctor, have to look at those things too. Stress, anxiety is a major cause of insomnia. And I'll come to talk about insomnia later in more detail, but insomnia, inability to sleep enough hours, the majority of those folks are usually either anxious or mental problem, depression, for example. Those constitute a big part of the insomnia population. Physical activity, we always advise physical activity for patients, for everybody, and at any stage, because it improves stamina, it makes your body more tired to go to bed. And lastly, not in bed enough time. I have multiple patients, especially in particular police officers that do 2-3 jobs during the day, and I have very little time to spare for sleep to support their family, which is unfortunate part of this day and age life that we live. No, I haven't had anybody tell me sleep is not necessary yet, but being productive and competitive and getting forward or ahead of the others, unfortunately, can cause problems. Okay, what can sleep deprivation do? It affects the body. The studies that have been done in people that sleep short hours does suggest that there is increased mortality. Now, interestingly, it is less significant than studies that shown people that have to sleep very long hours in terms of mortality. Those have a higher mortality. But either way, the effect on the body parts, the body system, like the cardiovascular system, as you see, heart rate, increased blood pressure. Some of those disorders, like sleep apnea particularly, increase the risk for stroke, heart attack, heart failure, early death, if it is severe and untreated. So that's a major one. Immune system, many things affect the immune system. Infection, viral infections we have, medication we take. But poor sleep will also do so by affecting the hormonal, the normal rhythm of the brain in producing this or that hormone. Diabetes, we mentioned earlier. If your sleep is quite disrupted, the production of the hormones will be disrupted. including the thyroid and growth hormone, and as well as the cortisol. All those hormones are necessary for life. They're not a side effect of the sleep problem, but when they're not produced in the normal mechanism, normal way, then we have a problem. Now, diabetes, poor sleep and diabetes usually makes it harder to control the diabetes. They've studied it in sleep apnea, and they clearly see that it's hard to control diabetes of people with sleep apnea, for example, untreated. But as you see here, the shorter hours you sleep, the worse the sugar control will be. So insomnia. Most of us think of insomnia as short number of hours of sleep. And that is the majority of insomnia. Now, some may define insomnia that they wake up frequently or too early in the morning, or that they're not refreshed, not rested after a regular sleep time in bed. And all of those are possibilities, but the majority are people that are unable to actually maintain their sleep for long enough hours. Let's go back there, sorry. So insomnia. Now this is a very common disorder. It's about 20% of the population at any time. So how many of us are here in this room? We're about 7 or 8, probably 1 or 2 of us have insomnia. Now, insomnia can be normal reaction of the body in situations such as, a birth of a child, where the mother is very sensitive to noise and wakes up thinking the baby needs help, or a disaster in the family, a death, that folks are very upset and unhappy and mourning the situation, and they cannot sleep well, but that's normal. Now, when it becomes persistent, that is beyond the period of mental illness that people had, they're still unable to sleep well, then it becomes abnormal and the complications we're talking about. Anxiety, depression is common as a reason for insomnia. Folks may have an event in their life that caused them to be more awake at the time, a new job, for example, an exam or a set of exams where you can't really sleep well the night before. The reaction that folks have to insomnia may worsen the situation. What do people do when they cannot sleep? Oh, they'll spend more hours in bed. They'll turn the TV on or their computers or the radio, whatever, and lie in bed hoping that that will put them to sleep, or read a book. They start taking this, that, or the other medication over the counter or prescription to fall asleep. All these interventions that I mentioned here are poor, or constitute poor sleep hygiene, and worsens the insomnia as time goes by. And thus we always have to talk about that with patients. And I'll describe what's a good sleep hygiene towards the end of this talk, but let me move on to sleep apnea. Sleep apnea is quite common. In men in this country, it's close to 8%. Women, close to 5%, children, about 4%. So we're a country of 300 million. You can imagine the numbers that we have. What causes sleep apnea, or what is sleep apnea to start with? Sleep apnea is when the throat collapses or narrows during sleep, and so the patient is unable to take a full breath or any breath at all. So if the throat totally collapses, They're trying to breathe, nothing goes through until the brain senses that the person is trying hard to breathe and wakes up the muscles. And what happens? So the gasping sensation. Now, that partner would quite easily notice what's happening, and they may be the one that give the nudge to wake up their bed partner so that they can breathe. But obviously, unless they're awake all night watching that person, they're gonna miss plenty. In adults, the most common reason for that is obesity. And fat deposit in the neck causes the throat easier, have the throat easier to collapse when they fall asleep. Now, there are medications that can worsen the sleep strength, like Valium, narcotics, alcohol. So sleep apnea is worse in the nights if people had alcohol. In children, on the other hand, they do also develop insomnia. Their main reason for that is large tonsils and adenoids. And the therapy is a little different in children. If it's significant disorder, they remove the tonsils and adenoids first and see if the situation resolves. But this snoring and choking through the night, what it caused the oxygen to drop, the heart rate to go fast off and on, the blood pressure rise, and all adrenaline production frequently. So folks wake up, even if they slept 8 hours, 9 hours, and they feel tired. It's just that sleep was very poor. It's because they're waking up so many times through the night they're not aware of. But it also causes them daytime sleepiness and fatigue, dozing off in many different situations. Accidents can happen. So what are common complications of sleep apnea in particular? High blood pressure is one. If it is severe, stroke, heart failure, heart attacks, early death. But it also can cause accidents on the road, depression, memory problems, sexual problems in men. So it's not a sleep-only problem. It affects the whole body. And that is why it needs to be addressed. And it is one of the most common reasons we see folks for sleep problems in clinics. How do you treat sleep apnea? The most common, and most of you have heard of, is CPAP, or continuous positive airway pressure. What is it? It's an air pump. Basically an air pump that pushes air either through the nose or nose and mouth and keeps the throat open. It stents the throat open, basically, so that a person can breathe in and out. That's the most common form of therapy. And but it's not the only one. I would say probably 85% of patients are treated that way. But oral appliances are devices just like the teeth guard, where it fits on the lower jaw and upper jaw and pushes the lower jaw forward, basically trying to open up the back of the throat. That is an option for mild disorders. Surgery used to be more often in the past. I'm sure you've heard of people that they remove tonsils, adenoids, the excess tissue in the back of the throat. Not really done as often anymore because it's not an exact science. And even when you do it, very often, a few months later, the situation is back to where it is. There are more intensive surgeries that we rarely ever go to, breaking the jaw from up and down and pulling it forward and wiring. Now that's pretty successful, but as you can imagine, not many people will go for that, nor we would ask for it. Some of you may have seen those commercials of people throwing out the mask and basically telling them you don't need that anymore, and Inspire will do the job for you. So unfortunately, it's a very in my mind, a little naive type of commercial, because Inspire is a pacemaker that they cut and put under the skin in the chest and then stretch a wire under the skin all the way to the tongue. And what happens is when a patient breathes at night, the machine senses that the chest is moving, sends an electric signal to the tongue, contracts, spasms. So open up the back of the throat and then let go, and spasm, and let go, and spasm through the night. Now, clearly, Inspire, as many patients have asked me about not wanting to use CPAP, is there for folks that fail the use of CPAP therapy and they have significant disorder. So it has a place, but definitely a very small place in the management of sleep apnea. We always tell folks, lose weight. Losing weight is helpful. And yes, I've had patients lose enough weight that they no longer have sleep apnea and no longer need therapy. Beyond the benefits, of course, that losing weight will be with heart and diabetes and blood pressure and joint problems, and it also helps the sleep apnea. So that's you know, the two words I have about sleep apnea. Unfortunately, I don't have pictures here to show you what those machines are. Now, how do we diagnose it? Sleep study. So in the past, we used to do sleep studies in the sleep center, where we attached all sorts of monitors to measure many different parameters of the body during sleep. But over the last 5 to 10 years, we're using lots more of home studies, devices that we give patients, simpler to use, and they sleep with it at home, bring it back, and we look and see if they have sleep apnea. So it is easier in diagnosis now than when I trained for sleep. Restless leg syndrome. So restless leg syndrome is basically a sensation. And by the way, restless leg syndrome is also common. By the time folks are in their 80s, about 20% of that population would have it. What is it? It's uncomfortable sensation, usually in the legs, but it can happen in the arm. I've had patients even in the neck. That happens later in the evening, early part of the night, in which the afflicted person keeps having to move, whether it's their arm or their legs, to feel comfortable or get up and walk, to basically suppress that uncomfortable sensation. The sensation could be, ants crawling under my skin, pain, electric, shocks. It's described in many, many different ways, but the whole landmark description of it happens in the late evening, early night, and by the time morning comes in, it's gone because it's in that part of the 24 hours. And folks aren't able to fall asleep because they keep having to move or to do something or massage around that. And by the time they fall asleep, it'll be late already. Now, those folks, if you tell them go to sleep in the morning, oh yeah, they'll sleep without that symptom. And all that initially. Now, if it becomes severe and poorly responsive to medication, it may even move to 24 hours symptom. So restless leg is a common one. What causes restless leg syndrome? There are secondary causes like certain types of anemia, low iron stores, kidney disease, some rheumatological illnesses, many different medications, for example, nausea medications, antihistamines, lots of the depression pills that are used can increase restless leg syndrome. Now, restless leg is not a sleep study diagnosis. It's a history diagnosis. But a sleep study diagnosis can happen. Another illness that can happen with restless leg is called periodic limb movement disorder, meaning during sleep, the leg is jerking. And it does it on a regular basis. It's not a karate movement, but it's a slow movement in the legs, and the bed partner will notice. And when that happens, it also can disrupt sleep. Almost 80% of restless leg patients have also that problem at night when they are asleep. The bed partner will notice the leg jerk. So how do we treat restless leg syndrome? We evaluate first for second causes. secondary causes of this, including the low iron stores, the different medications people have, family history. More likely than not, if your parents had restless leg, that you have a higher chance of developing it and developing it even earlier. So that it can happen in kids too. That is something that they would need to be evaluated for. If the parent notices that they keep having to move or wanting that massage or something of the sort, otherwise they just can't stay still, then that may be something to look into. We have lots of medications for restless leg. They're similar to the medications used for Parkinson, but small doses, ropinirole, pramipexole, medication that you use for neuropathy like gabapentin. We use those too. So it is controllable of an illness. I remember having a patient, she was very miserable. I think she was in her 60s, with inability to sleep and just miserable. And then we worked her up and started on therapy. She was so happy. She went on TV talking about, this illness and how now she can sleep and so on. So it is a very definitely disruptive illness. So this here talking about the medication that we may be using in sleep, and lots of folks use melatonin, as you well know. Unfortunately, use it in a very high dose over the counter, but valerian roots, and there are other stuff that were in the market and gone because of complications. But as medication to use to help people sleep when they have insomnia, those are the common ones you see. The benzodiazepines are the Valium, the clonazepam, the Xanax, the triazolam. The non-benzodiazepine are the Ambien, the Sonata, the Lunesta. There's about 4 of them. And then now there are even newer medications to help people fall asleep than this. Fortunately, they're expensive, but they have a role to play. So I said earlier that we're going to talk about what to do or how to make the bed environment a better place to sleep. Regulating the sleep-wake cycle is always good for the brain. The brain is not made to, today I'm going to sleep at 10 o'clock in the evening, tomorrow it'll be 2 o'clock in the morning, and the day after 7 o'clock. And you can see that shift work is a major issue with this. There's a night, day, night, and all over the place. Very disruptive for sleep. So somebody with insomnia will say, as much as possible, regulate the sleep-wake time, especially the wake-up time. We can work on trying to get more sleep during the time that they need to be asleep, but the wake-up time has to be fixed so the brain has some normal rhythm. Napping during the day for people that have insomnia does not work. Now, many folks ask me about napping. Napping is a normal function of the brain in the early afternoon. It does not relate to food. It is a normal circadian rhythm. That's why many societies have those naps in the early afternoon, siesta, where I come from in the Middle East. People go home, eat, sleep, come back and work in the afternoon. And that's a completely normal thing. Now, if you have insomnia, though, cannot sleep well at night, we advise against the napping because it will take some of the edge of the need to sleep from the nighttime. Relaxation, stress. As I mentioned earlier, anxiety is a major cause of insomnia. Relaxation techniques can be many different types. Some people would do muscle relaxation techniques, concentrating on each muscle to relax it gradually to feel better, and then fall asleep. Others may end up, unfortunately, watching TV or reading a book so to take their minds off of it. But unfortunately, that causes vicious cycle down the line. So I always advise against it. I always advise my patients, and I practice this myself every time I go to bed, though I don't have insomnia, is you put your head in the bed to sleep is because you're sleepy, not because your husband, wife, bed partner want to go to sleep and you have nothing else to do, so you might as well go to sleep. If you're not sleepy and going to bed, you'll end up staying long time in bed awake, which is not good sleep hygiene. So you go to bed sleepy, put your head down, immediately build a movie in your brain about something you enjoy, whatever that thing enjoy, a fantasy that you have. And you're the director, you build the movie around that fantasy. The reason for that is when we are relaxed, it's much easier to fall asleep. When we are, on the other hand, have mind racing, oh, tomorrow I have to do this. Oh, why did this guy tell me this today? Oh, my car broke down. I need to fix it. Where am I going to bring the money for this? And all those daily issues that we all have, we take to bed, that will stop us from sleeping. And that's why the relaxation and the movie in the brain would be helpful. Caffeine, as we all know, is the most common stimulant that is used in the world. But alcohol, people seem to ignore that a little bit. Alcohol is a hypnotic. It makes people sleepy. So if you use it before bedtime, yeah, it's easier to fall asleep. And after a few months, you know what? This one drink is not doing it. I need 2 drinks because now the liver is tolerant. Yeah, I need 2 drinks, 3 drinks, and you can see where that is going. So definitely not something we advise. If people enjoy drinking, we ask that they drink earlier in the evening and not use it as a sleep medication. The bed environment. You know, each one of us probably have a different level of light that they would rather. Some folks would rather hear some noise distract them. Others like it extremely quiet. So that temperature, I've asked that a lot. Should I use high or low temperature? Whatever you feel is better for you. It does not really matter. On the same topic, I remember seeing a patient once with insomnia and can't sleep during the night. And then taking the history further, and then it came out that he sleeps in an apartment over a dancing club. and it was very telling. So the point is, the bed environment has to be comfortable for you to sleep. But another very important point, leave that bed for sleep. The bed is not there to do the taxes or to review your computer or read or watch TV. Leave that somewhere else. The bed is to go and sleep, because many folks are actually doing all these activities I mentioned, and they end up in bed for hours doing this. And I have patients that turn the TV on and watch an hour, and then they fall asleep. Then if they wake up in the night, oops, TV off, turn back on, because it's now the hypnotic. It causes disruption to the bed partner, but also dependency on this hypnotic, I would say.
College students do that.
Say again?
College students do that.
College students do lots of that. College students drink lots of coffee and stuff to stay awake and do an all-nighter studying, thinking that will be great, and then crash for long hours. Yes, unfortunately, that is true. Clock watching, very important. And when I'm talking to patients, I say, oh yeah, you wake up in the middle of the night. Yeah, when? Oh, 1 o'clock I wake up, and then 3 o'clock I wake up, and like, how do you know? Well, the clock next to me on my phone. And that clock watching is very important. The only thing it does, increase your anxiety. Nothing more than that. Oh boy, I'm still awake. 1 o'clock. Oh boy, there's another 2 hours before I have to get up to work. And anxiety, and that will make it even worse to fall asleep. Not mentioned in there, electronics. Unfortunately, now we're attached to our phones as our almost like a lifeline, and responding to the messages, the texts, the Facebooks, Instagram, 10,000 different things. If it rings, oh, somebody, let me, okay, put it back and try to sleep, and so on. Very poor sleep hygiene. Unfortunately, it's an epidemic that we see in patients. So some of the stuff we advise patients to do is lose weight. It's good for your sleep. It's good for your health altogether. Don't try to eat full meals right before you go to bed. Heartburn can happen. Regurgitation of food, all that is disruptive. This is very important. So we said when you're sleepy, then go to bed in the evening and build a movie in your brain. But you may not be successful in falling asleep. And what I tell my patients what I tell them to do is 20, 30 minutes of being in bed and still very alert, get out. But not by looking at the clock or your phone or whatever. Estimate it's been that long and unable to sleep. Get up, go to the living room, boring reading. I'm not talking about a really interesting novel that you want to continue reading, or definitely not a computer or TV, but boring reading, magazine, newspapers, stuff that you really don't need to concentrate on until you feel sleepy, then go back to bed on a regular basis. Insomnia definitely is a harder disorder to treat than sleep apnea and many of the other sleep disorders. It takes lots of effort on the person to solve this problem. So exercising, I always advise my insomnia patients to exercise early in the evening. Not very close to bedtime, at least space it out, at least 2 hours. Your body will be more tired, more likely to help you fall asleep, along with all the other health benefits. Tobacco is a stimulant as well, and you know, it might play a lesser part in terms of sleep than other health issues. You know, tobacco, whether this vaping, hookah, you know, all of it is tobacco, and it's not good. Watching the clock, like we mentioned earlier, avoid that. What I do, or what I tell my patients are, cover their phone. Just you can't see it. It's there. The alarm will go off in the morning and wake you up when you need to go to work, but cover it up. You don't see it. Bedtime routine. For kids, that seems to be important. And each one of us have some sort of routine that will basically prepare them to fall asleep, whether it's the story or the watching something on TV, or you know, whatever it is that you find works for you. I advise very much against long screen time for kids. Daytime, unfortunately, I mean, who of us haven't seen kids go to anywhere with their eyes on their iPad? They're almost like zombies walking. And they sit down, they're on that thing, continuously playing games and all that. First, that would mean lack of exercise, lack of a normal interaction with other humans or the environment, and then poor sleep. So this is another epidemic in kids, unfortunately. Many of the sleep disorders, and I've only talked about few. There are many more, like narcolepsy. Some of you may have teenage children that have narcolepsy, develop narcolepsy, the sleepiness all the time, regardless how much time they sleep. They may have sleep paralysis and many other symptoms. Night owls, people that cannot fall asleep till early hours in the morning. They had it since they were teens, and you know, that disrupts their sleep. They end up with a few hours of sleep. Like almost about 10 to 12% of high school kids have night owl physiology. So they end up going to bed nicely as their parents ask them to, but they're unable to fall asleep, regardless what you do. They'll fall asleep 1 o'clock, 2 o'clock in the morning, and come 6 o'clock, 7 o'clock. Oh, hey, wake up! It's sleep. It's school time. They're exhausted. Weekend, oh, they'll sleep to noon and wake up feeling rested and refreshed. So you can see the problem. That's called circadian rhythm problem. Jet lag when you're flying overseas, especially east towards Europe. Shift worker, a big issue in a 24-hour society. So all these are illnesses that can be helped. And what I would suggest that you approach it with your sleep physician. Well, actually, you can bring it up with your primary physician. They would refer you to a sleep physician or order a sleep study if they think it's sleep apnea, because there is help for all this, all these problems and others. Now I'm going to stop here because I really like it to be interactive and I want some questions. So the floor is yours.
I have a question.
Mhm.
With the rise of drinks, like 5-Hour Energy and Monster drinks and things like that, have you seen an increase in people suffering with insomnia?
So the question was of the energy drinks and 5-hour drinks and that sort of thing. All depends on how strong that drink is. If you drink a really heavy coffee drink in the morning, it can last till bedtime. So if those folks are drinking those heavy energy drinks multiple times a day, yes, it may. Yes, it does interfere with sleep, no doubt. Or they may say, hey, I drink my iced tea, multiple times a day, or anything, coffee, Cokes, anything with caffeine. Yes.
So we do have a question virtually, and they asked, what do you think of time going to bed? I heard that if you go to bed before 11 p.m., the body heals itself and the quality of sleep is higher.
If you go to bed at 11 p.m.
Before 11 p.m., yes.
Before 11 p.m. So sleep time varies between people. As you well know, kids don't go to bed at 11 p.m. They'll be exhausted by then. The time to go to bed is less important if it is more evening, early night, than the length of time that the body needs. And you'll know if your body needs 8 hours or 9 hours by usually in the weekend when there's no disruption, nothing you need to wake up for. How long do you sleep? Oh, much more than I sleep when I'm working in my working days. You know you're sleep deprived. So the sleep deprivation part is more important than what the question was suggesting, healing powers of sleeping before 11 o'clock. I'm not aware of that. No. Yes.
You mentioned about sleeping the 4 or 5 hours. So one of the doctors that used to
Yeah.
that,
Mhm.
but that in the long run that affects the brain, right? Or is it possible to have somebody that sleeps just a few hours, 5 hours, and that's their whole night, and then not have any consequences later on?
If they're sleeping those 4 or 5 hours and they are rested, they're able to function normally, there is no problem. Sleep as a function similar to many different functions of the body is what they call it a bell curve. So there is the very short, very long, and most people in the middle. As long as they're able to function fine. Now, if you tell me, oh yeah, I sleep 4 or 5 hours, but oh boy, all that coffee mug that I have to use 4 or 5 times a day to be able to finish the work, then you have a problem. But hey, I'm rested, I'm fine, I'm doing well, then there is no issue.
In the long run, you won't have.
No, not that. It's the people that have problems with fatigue during the day and sleepiness during the day and they're unable to sleep at night. That's a whole different story. Then we call it insomnia. If you're sleeping 4 or 5 hours and you wake up fine, you don't even have symptoms to complain about. Now you may complain, hey, when I wake up and my bed partner is still asleep, and that bugs me, for example.
Another question, which I actually have the same question as they do. They asked, what if one day I sleep for 4 hours and the next day I sleep for 12 hours due to work? Can I make up the lack of rest of the night that I slept 12 hours, or is there such thing as catching up on sleep?
Unfortunately, that's a myth. There is no catching up. You're not going to be catching up on the hormone productions and the brain health. I mean, during sleep, one of the function of sleep is promoted as memory consolidation. You can't say, oh yeah, I'll leave it to the end of the week to consolidate my memory. For example, no, this huge variation of sleep time is not healthy, definitely not healthy. The brain will do much better with regulated wake up and sleep time. You'll say, oh yeah, but we had a party that night, fine. I mean, exceptional here and there, something. But it's not on a regular basis, not good for the brain. And will interfere with the circadian rhythm and the, as I mentioned earlier, hormones and body functions.
Consistency is very.
Consistency is always good with sleep, yes.
Another question I can ask is, if we do choose to take melatonin, is how much should we be taking or how often?
Okay, so melatonin is a hormone produced in our brain, usually in the dark hours of the day, and it helps us sleep. That and sunlight is what controls our circadian rhythm. So the sunlight comes up, we wake up, we're creatures that live during the day, and at night we go to our homes, hide from the animals, and that's how it started, if you think of it. Protective. Melatonin is used very commonly as a sleep medication. It actually regulates the circadian rhythm. Now, it does make people sleepy, and if people are going to try melatonin, we advise small doses. Small doses meaning what? Less than 3 milligrams. I hear people take 15 milligrams and so on. Those are doses to treat actually major sleep disorders, not a sleeping medication. And when to take it is another thing. Some people tell you, I take it before bedtime, I feel sleepy and go to bed. Others may need to take it several hours earlier so that by the time bedtime comes in, they're now sleepy. So it varies. Just like all the other medication people use for sleep, for example, what's the most common medication people use for sleep? Anybody here knows? The over-the-counter, the Tylenol PM, the Advil PM, or Benadryl, antihistamine. That's what the sleep ingredient of it. And yes, it does have a side effect of sleepiness, but sometimes even hangover effect when you wake up in the morning. But long-term use of that, unfortunately, may cause memory problems. Now we know, so we don't like to use it in that fashion. If somebody has regularly problems sleeping, there is a reason, and it's best addressed by a sleep doctor to figure out the underlying cause or whether it's safer to use other medications that may give even more restful night for the patient.
But the over-the-counter melatonin, it's good. But is it still good to take it like very often, or it's just once in a while?
So, the once in a while. Once in a while, anything in terms of medications for sleep is better than a regular medication. Now, obviously, it's like if you don't, you won't sleep. So you need to use it. But once in a while, oh, yeah, you know what? I was, I don't know, I had fever and I was tired. I can sleep. Let me take a little bit. That's not a big deal. Regularly, I need to take it every day because otherwise I don't sleep. There's a problem. Yeah.
I'll do one last one since we do have 4 minutes. I've always been told that, if I go to sleep an hour, put my phone up 30 minutes before or something, and then before those 30 minutes, that last hour, to make sure that I have either blue light glasses on or turn my phone into like night mode, because the light can affect if you go to sleep or how long it takes you to go to sleep. Is that true?
So the blue light is the one the brain responds mostly for in terms of sleep. So one to use eyeglasses or sunglasses for sleep purposes so that they don't get alerted by sun. Best is against blue light. The issue with I guess what you're saying, the half an hour before you go to bed, you're converting to blue light. Well, I mean, it makes sense. Even better makes sense that you have a relaxation period before you go to sleep that doesn't involve electronics.
Yeah.
I'm going to put it in that fashion. But if you have to use it, yes, use the setup. There is a setting in there that allows for such. Yeah.
Okay, if you have no more questions, then I can wrap up. So thank you so much for coming and for this very informative presentation. We appreciate you taking the time out of your busy day to share your experiences and your expertise on this topic. We'd also like to take a moment to thank Kelsey-Seybold Clinic for hosting us here today in person and for sponsoring the Health and Wellness Awareness Series. We hope that you will make plans to join us next month for our Happy Healthy Holidays presentation. If you enjoyed today's program, make sure to like us on Facebook, follow us on other social media accounts, and visit our website at womensfund.org to stay current on future events like this one. A recording of today's presentation will be posted on our YouTube channel within a week. And so that concludes today's presentation. Enjoy the rest of your day and please stay safe and healthy.
Yeah.